Welcome to Gitanjali Group of Institutions. Here I am Prasad Sirisetti. So before going to start today's session, I want to thankful to all of you because as I am getting a positive feedback that you are following us. Thank you so much, future nursery students. So today my topic is blood pressure. So today's session is blood pressure. So what is a blood pressure? So before going to tell what is the meaning of blood pressure, let me tell what is the meaning of pressure and what is the meaning of blood. As we know that being a medical persons, the blood is a liquid tissue. As we know, there are a lot of the kinds of the tissues are there. Epithelium tissues, connective tissues, also a lot of the things, different kinds of the tissues are there. Where the blood comes under, there is a loose connective tissue. So here, this is the blood is a tissue. And what is the meaning of pressure? You know, my dear students, so here the pressure is having different kinds of the things. I can say that the water has lot of the pressure. You know, when there is a reservoir, when there is a dam, so when there is the water is going to the over, in that case, because of the pressure, the dam might be got that reconstruction. They might be get some destroy level. In that case, we need to conclude the water has more pressure. And coming to here, the blood have some pressure. So because of that pressure only, the blood circulation is going to happen. You think once the blood circulation is going to happening anti-gravitation. We know that what is the meaning of gravitation? The gravitation is nothing but when the something is going to up, it must come down. That is as per Newton law. That is called as gravitation force. But what our body is doing every second, what the blood circulation is going to happening. So here there is a heart. Every second there is a blood circulation is going to happen. Where the blood goes down until the feet. Again immediately it is coming, that is called as venous return. It is act like a anti-gravity force. So that is called as some sort of the pressure. So let me tell what is the exact meaning of blood pressure. Dear students, blood pressure or tension is extended on the arterial wall of the pressure. I want to say, for suppose you take some water, you pour on the floor. So how much you are pouring, so when it is going to the act on against the wall, so how much the pressure is getting, that is exact meaning of the pressure. The same thing when during the pumping of the blood, when the pumping of the blood, the amount of the blood is going to push out over the wall of the artery. You can see here, this is the artery wall. So when the amount of the blood is going to act against the wall of the artery, so here it is generating short kind of the pressure. So that pressure is called as blood pressure. Why we are calling blood pressure? The pressure is creating by the blood. That's what it is called as blood pressure. So being the human being, everyone must be have blood pressure. Then only the person can alive. Then only person can get a sufficient blood supply for all the body parts. So this is exact meaning of blood pressure. You can see here, so whatever this is the exact wall of the artery. So here, so where the blood is going to act against the walls, then the pressure is going to form. So that is a picture. You can see here, so here I want to say there is a two kinds of the pressure in the human heart. The first one, before telling that, I want to tell one medical terminology. What is the meaning of systole and what is the meaning of diastole? Dear students, you remember what is the meaning of systole? Systole is nothing but contraction, whereas diastole is nothing but relaxation. As I discussed for the last class, the heart pumping is very necessary. The heart main function is pumping of the blood. So how it is going to happening pumping of the blood? You think Yes, this is my left and this is my right. But you imagine this is the upper chambers of the heart and this is a lower chambers of the heart. This is a both atriums, this is both ventricles. See here, when the both atriums are going to contraction simultaneously, when the both ventricles must be relaxed. When it is going to contract, it must be go for relaxed. So contraction is nothing but systole. Relaxation is nothing but diastole. So this is the point you must remember before we are going to in depth of the blood pressure. And before that, I want to tell one more example. You see, everyone is having a water tank. So when the water tank having water, full of water in the tank, in that case, so in the ground level, if you open the tap, if the water is full of the tank, when you open the tap, how much pressure fully water will come? Noted the point. And second one, when the water tank is having 90% is empty, there is a 10% of the water, you just open the water of the floor level, then how much pressure is getting? So this is the example you just compensate on blood pressure. When the cardiac output is good, when the blood volume is good, when the heart is doing good functioning of the blood, pumping of the blood, then the systolic pressure is good. And when there is no sufficient blood, then there is something, the problem will happen. So that and all things I will explain in the next session. So here you must remember what is the meaning of systole and what is the meaning of diastole. When the both chambers is going to constriction, that will be against, that will be called as systolic pressure. When the both ventricles is going to relaxation, that will be called as diastolic pressure. You just imagine when the both atriums is going to constriction, so whatever blood is there in the both atriums, so suddenly it will going to push down. The pressure will be 100%, little bit increasing, then diastole. So when the diastole is nothing but relaxation therapy. So when the diastole is nothing but it is going to relaxation of both ventricles. So somewhat the pressure will be decreased. So that's what you have to see, systolic pressure and you have to see diastolic pressure. And before going to tell, my dear students, as we know that I am telling that we have a well infrastructure, well reputed college is none other than that is nothing but Sirisetti Nursing Institutions. So in our college, GNM programs, GNM 3 years and BSc 4 years are there, and our availability is food, accommodations, transportations, clinical, scholarship, whatever, everything is available. And one more thing, we have one of the golden opportunity where as we are running the online education. So in our West Bengal, none of the institution is not providing such a kind of the online education. So you can see here the physical education is going to happen as well as simultaneously the online education also going to happen. So please hurry up, my dear students. So take the admission and success your life. So let us come for the point. As I told you, the systolic pressure and diastolic pressure. So commonly, so normal, the systolic pressure is 120, whereas diastolic pressure is 80. And this is a time to understand why the 120, why the 80. So 120 is a pressure. As I told you, the both atriums, when the systole, when the constriction is going to happen, the pressure will be little high. So when there is a diastole is going to happen, definitely there is a relaxation things is going to happen in the both ventricles, the pressure will be little down. So there is 120 is a systolic pressure and 80 is a diastolic pressure. This is actual normal blood pressure for each and every human being. Whereas, so if there is some abnormality in your arteries, if there is some abnormality in your cardiac function, then the blood pressure will be changes. So here you can see the normal blood pressure is 120 and 80. you can see, as I told you, so there is a some problem. If it is blood pressure is increasing more than 140/90, that will be called as high blood pressure. So that we can call as in our medical terminology hypertension. So everyone used to think that blood pressure is a something BP. No, blood pressure is a name of the medically we can call the pressure is having for the blood, that is called only the normal blood pressure. When the blood having pressure more than normal, like 130, 140, 150, that will be called as hypertension or high blood pressure. When the blood pressure is below the normal, like 90, like 70, like 100, that will be called as hypotension. That differentiation I will tell here. So clinically we can see here, so here where the green indication is coming, so 120/80. So here it's you can see systolic blood pressure, here you can see the diastolic blood pressure. So where you can see the green indication is telling 120/80 is a normal blood pressure. That's what indicated in the normal position as a green. Whereas you can see 90/60 is a low blood pressure. So when the blood pressure is getting down, that indicates there is a problem in the blood volume, there is a problem in your cardiac output, there is a problem in the cardiac function. You must understand when the blood pressure is going to down. My dear student, I want to tell, when the person is going to die, the blood pressure will be decreased slowly. 90, 60, 50, 20. When the person is having 20 blood pressure, that you need to think the person is going to somewhat complication. Is going to unconscious, is going to coma. So that's what 90/60 is an indication for the low blood pressure, 120/80 is a normal blood pressure, and 140/90 is a hypertension. We can call it as pre-hypertension. It is telling warning signs that your blood is having getting more pressure. That is called as 140/90. Whereas 160, whereas 180, whereas 200, that is more pressure. Is it? So you think that 180 when we are having blood having pressure, that indicates there is so much of the problem for you. Just only the thing you just imagine, you just driving on the road. When the speed is 180, when suddenly some objectives is coming in front of you. So what is your situation? You may get some problem. You may get some accident. The same thing when the blood is having pressure more than 180, more than 200, definitely there is a problem. In that case, you may get some kind of kidney failure. You may get some sort of something problem in the brain, because the brain arteries and everything is very sensitive. The every arteries and nerves are very sensitive. When the pressure of the blood is having normal, the nerves and arteries can be satisfied with the pressure. When the pressure is going to increase, the blood vessel wall can't be tolerant. In that case, there is a damaging of the wall of the blood vessel. In that case, there is a bleeding will occur. When the bleeding is going to happening, the clot will happening. When there is a clotting is going to happening in the brain, definitely the person will get paralysis. So these are the things we can observe. So that is the clinical things we can observe when the blood pressure is going to 180. So this is actual significance for the blood pressure, different kinds of the things. So you can see here what are the factors are affecting on the blood pressure. What it is the meaning of factors. So the blood pressure is having some kind of factors. Let me tell what is a factor here. So here see age. Coming for the age, when the small children, before you want to know factors affecting of the blood pressure, you must understand the blood pressure is depending on the cardiac output. If the cardiac output is good, the blood pressure will be normal. If the cardiac output is going to increase, the blood pressure will be increased. There is an interconnection in between the blood pressure and cardiac output. You have to know what is the meaning of cardiac output. The amount of the blood is going to come from the heart. So that is called as cardiac output. So that session I am going to discuss in the soon, but you must understand, so within cardiac cycle, within one cardiac cycle, how much of the blood is we are getting for the distribution of the blood for the body parts, that will be called as cardiac output. Let us see, the first one is age. So for the small children, the cardiac output will be less. Why it is less? The small children, in the sense, the muscle of the volume is less, the blood volume is less, automatically cardiac output will be less, and automatically blood pressure also not that much more. It will be like 90 or something. Is it? And next one is exercise. You just walk and check your heartbeat. It is normal. You just run away. You just feel it. It is blah blah. So it is going to very increasing your heartbeat. When the heartbeat is increasing, it indicates your cardiac output also increasing. It seems your blood pressure also going to increase. There is an interconnection. So when you are doing exercise, your blood pressure is going to increase. That is a factor. And next one is a stress. Yes, compared to the normal, if you are the normal without stress, your blood pressure will be the normal. If you are under the stress, if you are under the depression, if you are under the anxiety, definitely your blood pressure will be increase. So that is a point you must remember. And next one is a race. It's nothing but different kinds of the species, different kinds of the peoples, depending on the blood pressure will be altered. And next one is a genetic. For suppose, for my family, for my ancestors, for my father, for my mother, in their chromosomal alignment is having this kind of the gene of blood pressure, definitely for the next generation I may get the blood pressure. So this is also one of the factor to get the blood pressure. And next one is a food. So if you are taking the balanced diet, nutrition diet, the blood pressure will be good. Whereas if you're taking a spicy food, if you're taking salty food, if you're taking some kind of the food, then blood pressure will be increased. And next one is obesity. Obesity is nothing but when your muscle is big, when you are obese, automatically the blood volume will be increased, automatically blood pressure also will be increased. And next one is smoking. So when you are smoking, then definitely the blood pressure will be increased. And next one is alcohol. When you are taking alcohol, definitely the blood pressure will be increased. And next one is when you are some diseased, the blood pressure will be increased. My dear students, so these are the factors affecting on the blood pressure. In some situations, this is going to be increased. In some situation, this is going to be decreased. So my dear students, so today's session, I have discussed about what is the meaning of blood pressure and what are the types of the things we can see the blood pressure and what are the factors are affecting on the blood pressure. I hope this is a topic is very helpful for the nursing students, future nursing students. Please note it down and you can go through my videos. My humble request, forward to your juniors and forward to your friends. By that they get some awareness about our channel. So until that, please like, share and subscribe our channel. So we are for you as a digital platform. We are giving for a huge of knowledge in our nursing education. Thank you so much. Until that, stay tuned. Thank you.